Muy buenos días. Antes de
Good
empezar,
morning. Before beginning today's session, we will give you some housekeeping messages to keep in mind during the session. Please keep your microphones muted. We would like to warmly welcome you to this workshop on recommendations to minimize the risks of COVID-19 transmission in the tourist section in Latin America and the Caribbean.
Transmissions in the Latin America and the Caribbean tourism sector. Contamos con interpretación en inglés y español. Para acceder a la interpretación, por favor, hacer clic
We have English and Spanish interpretation. To access your language, please click on the icon on the bottom of your Zoom screen and select your preferred language.
To access the interpretation, please click on the world icon located in the lower margin of the Zoom and select the language of your preference. Los invitamos a usar el chat para poner sus preguntas y comentarios.
We welcome you to use the chat to post your questions and comments because we're very interested in knowing what you think and know about you.
Comments and questions. Queremos agradecer la presencia de la
We would
señora.
like to thank Ms. Adela Morera and Juliana Bettini, tourism specialists, who will give us their opening remarks. Adela and Juliana, go ahead, please. Thank you, Grace, and good morning, everyone. Thank you for joining us today and for sharing this morning with us. COVID has taken the sector by surprise, and it's jeopardizing the livelihoods in Latin America and the Caribbean. The IDB has been supporting the tourist sections in the beginning of the pandemic through two things. One, to provide direct support to the business mesh, and second, support to agencies to adapt to the new demands. In terms of support to businesses, we have protected the businesses and workers. And in this sense, we have the Aid and Training Center in Argentina with support from the IDB that opened last year that helped us keep employment in agencies with a critical situation for employment. In terms of the second aspect, I would like to highlight three actions. First of all, the IDB has developed an international tourist demand model based on real-time information, which is available on the IDB website. Why did we launch this model? Because in order to address the demand, we need to know the evolution of the destinations, but also of the most important source markets, because there's still a lot of volatility at this point. So companies and tourist sectors are facing very hard decision in terms of promotional resource allocations and other aspects. And the situation will continue to change over the next few months. That's why at the IDB, we developed this international demand tourist sector based a model with real-time information in order to assess the safest countries in terms of COVID transmissibility. And second, in order to support reactivation of demand, we have engaged in regional technical cooperation in order to foster the adoption of digital technologies that will enable us to enhance safety at the destination. For example, contactless technology or artificial intelligence that will enable us to identify better opportunities for travel. Finally, in order to foster tourist demand based on safety, the bank has developed regional recommendations to have some minimum standards in terms of tourist biosecurity standards in the region. Why? Because countries have developed biosecurity standard for tourism in order to protect their sector. However, many of these protocols are different from each other, and they were developed at the beginning of the pandemic. Therefore, there's confusion in terms of their scope and efficacy. So these are the recommendations that we're going to talk about today. And with that, I would give the floor to my colleague, Juliana Bettini, that's going to talk about these regional recommendations. Once again, thank you for joining us. Thank you, Adela, and good morning, good afternoon, or good evening. Today, almost 20 months into the initial COVID shock, and in spite of having seen some recovery over the past few months, the sector continues to struggle. There are constant outbreaks, the appearance of new variants, different levels of vaccination, depending on the country, as well as the questions that still surround immunity after vaccination. So consumer confidence continues to be the cornerstone that affects us in the tourist sector. A survey by IATA at the beginning of 2021 said that 84% of those surveyed will not travel if they have to quarantine, and 62% believe that they will travel less as a result of business than before the pandemic. Tourist centers are trying to address the need for trust on the part of demand, and that is mainly by applying biosafety protocols that are very different from each other, like Adela said, both between countries as well as between sectors. And that is why these regional recommendations that the IDB developed on biosafety protocols were developed out of that concern on how biosafety protocols that were developed at different times throughout the pandemic fit the most recent knowledge on virus transmission and how we can create more consistency on the efforts implemented by the company from the point of view of the tourist needs at this point. The recommendations also aim at support small and medium-sized companies in the region that are so many and that normally do not have a lot of resources to apply the most recent knowledge about the pandemic in implementing their protocols. So one of the key messages that we want to convey with these recommendations, and it will be highlighted throughout the different presentations, is the need to not let our guard down during the pandemic. What's happening in Europe right now is a very clear signal. The recommendations call for constant updating on the protocols in place. We believe that this demand of permanently updating the health safety measures in the region will be part of our new normal. And if we are optimistic, it will be good in order to help us manage the tourist crisis in Latin America and the Caribbean when new health crisis emerge. So once again, thank you so much for joining us today, and I hope you enjoy this event. Thank you so much, Adela and Juliana, for your kind remarks. And now we would like to invite Ms. Maricruz Caris, Technical Director at the Institute for Tourist Quality in Spain. She will talk about regional recommendations to minimize the COVID transmission risk in the tourist sector in Latin America and the Caribbean. So Maricruz, go ahead. Good morning or good afternoon, everyone. I'm going to talk about the recommendations to minimize the risk of COVID-19 transmission in the Latin America and the Caribbean tourism sector. These are recommendations that we have been working on for the past 12 months. And I would like to highlight, although my colleagues Adela and Juliana have already mentioned this during their opening remarks, is how we have these regional recommendations. If we have learned something over the past few months during the pandemic, is that when we have a global health crisis, we need to respond with global responses. So the recommendations that we are presenting today aim at supporting this global response by developing guidelines that are voluntary in nature in order to harmonize these measures to fight the pandemic in an effective manner. I'm sure that for many of you who are joining us today, who were also present on the seminar or webinar we had on December 16th, 2020, several months have gone by. And back then, we envisioned a certain hope in the future with the beginning of vaccination all over the world. In Latin America and the Caribbean had some countries that were starting to vaccinate their population towards the end of 2020. However, back then, we had a lot of uncertainty ahead in terms of what to do with these prevention measures that we had been implementing for months at the time. I perfectly well remember that one of the things that we were questioning and the defense was based on expert opinions, and that is that we had to continue with these prevention measures in place because they were necessary and they would complement vaccination. Now, time proved us right because the appearance of new variants and infection waves reminded us that the pandemic was not over, and prevention measures continue to be more important and more relevant today than ever. In the past few months, we have collected a lot of lessons learned, and those lessons learned can be used to develop prevention measures and to know more about COVID-19 transmission manners in terms of management, control, monitoring, and communication of protocols. So we have learned a lot. And these lessons that we have learned must be incorporated in the protocols that we have been developing. These are lessons that we have included as part of the recommendations that I'm going to present today. How did we first begin developing these recommendations? Well, we started off with the diagnosis, which stemmed from reviewing over 150 documents and protocols that had been published all over the world, not just in Latin America and the Caribbean. These were protocols that had been developed at a private or public level, promoted by the different governments, the business sector, and business associations. And we have even protocols of hotel chains, both within and outside the region, and with different scopes and approaches. The purpose of this was to have evidence about what the protocols covered and what they left out. I am going to give you more information about that in the upcoming slides. We also asked the consumers, like Juliana said, what their perception of safety was and what was needed in order for consumers to regain confidence in order to reactivate tourism. So we launched surveys, we used social media and focus groups, and we also resorted to the private sector. We had interviews to know more about this perception of trust, what was working and what needed to be updated. So this diagnosis involved analyzing the client's itinerary in the sectors that were included as part of the recommendation scope. The recommendations we're presenting today include the hotel, local transportation, beaches, ports, and airport sectors. Why these sectors? Well, because in terms of hotels and local transportation, we have the highest number of tourists. Why beaches, ports, and airports? Well, because they are important tourist spots with a lot of tourism influx. So we identify the situations where both the client and the workers were at a higher risk of getting infected. In order to do that, we took into account the different transmission means for the virus: aerosols, a mouth or droplets, and contact with contaminated surfaces. One of the things that we did highlight in a lot of our protocols when we perform this diagnosis is that a lot of them, maybe because of the urgency in developing these prevention measures in the second quarter of 2020 and the urgency to have certain protocols in place to implement early in the pandemic, we highlighted the importance of transmission via contaminated surfaces. And we kind of overlooked transmission via aerosols. We're going to highlight that more later, as well as transmission by droplets. So what we did was to link the itinerary in the sectors that we specified here and the transmission route that mainly aerosols, droplets, and contact with surfaces in order to identify these risk nodes. That is to say, the hotspot where we truly saw a high transmission risk, and then to see what kind of coverage protocols provided for those. That is to say, to see whether the protocols actually covered these risk nodes. And based on that, we saw if the nodes had high coverage, that is to say that was green, or moderately covered, which was orange, or had a very low coverage, which was red. So we made different risk maps that were relevant throughout the project because we use them in supplementary tools and documents that today we're presenting together with these regional recommendations. So this diagnosis, when we did that, led us to three main conclusions. First, and this is something that was also anticipated during the opening remarks, the different levels of specificity protocols had in terms of scope, in terms of focus, and in terms of thoroughness. Second conclusion is the coverage that is for risk, that is to say situations for higher transmission risk in different tourist hotspots were well covered in accommodation, restaurants, and beaches, but the rest of the sectors lacked recommendations in terms of their risk notes. So they had good coverage and it was equal or higher than the protocols from other regions. And the third conclusion, and this is very important, like we said, the protocols had been developed with urgency and where we were lacking certain information on transmission and how the virus behaved, especially in how it got transmitted. And a lot of the protocols were focusing on contact with contaminated surface. But since it has been greatly proved in the scientific journals over the past few months that the main means of transmission are aerosols, just like with other respiratory diseases, we needed to update the protocol. So the recommendations that we are presenting stem from a basic premise, and that is that risk is not static. So to highlight the variability of risk when we write protocols is very complicated because we not always can we mention every single situation or every scenario that an employee or a client may be facing in a tourist environment. And that is why we drafted together with the recommendations that we created this tool that we will be launching today as well, that would help us supplement the recommendations with a risk assessment based on the situation. And I'm going to explain what I mean by that. Risk is variable because it depends on 5 risk modulating factors. Ventilation, the use of face masks, proper use of face masks, distance, exposure time, and relative humidity. So the combination of these 5 factors make risk higher or lower. So the column on your left shows the situations that would make it lower, that will lower the risk if the area in which we are as a tourist is outdoors, if we wear our face mask properly, if we keep the safe distance and have low occupancy rates, and if we have reduced exposure time. As a guideline, we have the 15-minute time limit, which is also what the World Health Organization provides for. But anyways, what we want to highlight is that the lower exposure time, the lower the transmission risk, and the lower exposure and the higher transmission exposure time, the higher transmission risk. And finally, relative humidity, which should be between 40 and 60%. This is so because relative humidity is below 40%, dry the air out, and dry air favors a suspension of aerosols in closed spaces. And there's even scientific studies that aerosols can maintain in suspension for hours. On the right, we have higher transmission risk. So poorly ventilated closed spaces without a proper face mask wearing, with high occupancy that does not allow us to keep a safe distance, with exposure time over 15 minutes and relative humidity under 40%, which is what fosters the suspension of aerosols in the air. for a longer time. So let us remember that to the bottom left corner of the screen, you can see this color-coded matrix that shows that variability of risk when we combine these 5 factors that I just explained in this slide. This is a matrix that was not developed by us for this project, but rather metrics by Nicholas Jones from the Oxford University. He's a research scholar, and a lot of publications have referred to this matrix throughout the year. Throughout the recommendations that I will be presenting today, whenever you have time to go over them, because it will be available on the IDB webpage, you will see that we are constantly referring to scientific journals and scientific articles, and this is one of them, and you will have the full reference on the document. In addition to risk variability, there's another significant aspect that I would like to highlight in terms of the approach these protocols have. So let me tell you about a situation that I personally went through over the past few months and how we included this in developing prevention protocols. This is a part of what I do, but there were 2 situations when I was in closed spaces with poor ventilation, with a lot of people that did not keep a safe distance. And I saw that some people were not wearing their face mask properly, that is to say, covering their nose and mouth. So on 2 specific situations, I asked those people in 2 different situations again to please wear their face masks properly. Interestingly enough, the response that I got both times in 2 situations was exactly the same, and that is what I am already vaccinated. This response shows, well, we would have to expand the sample, of course, but this is dangerous. And by this, I mean about the perception that we are fully protected once we're vaccinated. It's true that vaccination is working. There's ample evidence showing that vaccines do work. The countries that have higher vaccination rates are opening back up, but it is not the only prevention tool. Vaccination processes and screening and testing processes in the population fostered by the different governments must supplement, like we're showing, with prevention measures. In this sense, the measures that have a direct impact on transmission have to do with safe distancing, face mask wearing, reducing exposure time, keeping relative humidity under 40%, and having proper ventilation. It's important to ventilate. So these risk factors also focus on the transmission route by droplets and aerosols, but let us remember that it may also be transmitted, even though to a lesser degree, through contaminated surfaces. So hand washing is also key. With all of this, what I'm trying to say is that no prevention measure works in itself, but altogether lower risk. This is from Ian McCain, a virologist from the Queensland University in Australia, that shows in this graph how the whole theory of risk of this Gruyere cheese that you can see at the bottom of the screen. Each one of these safety measures or prevention measures that we implement to prevent infection is one of those layers of cheese. All of the layers have some sort of hole in them, but if we overlay the different layers of the different cheese slices, we will be able to prevent the virus from going through.
We've seen the approach of these protocols, these recommendations that we've developed. And again, that variability of risk is important to take into account. But how do we assess transmission risk? We've said that these protocols provide a framework for us to work in, but evaluating or assessing every specific situation is complicated. So these scientists from Nicholas Jones have established different levels of risk depending on the combination of factors. And how do we then assess the risk? We have developed a tool. It's available to you already for your own use. You can download it from the IDB website. And the goal here is exactly so that any manager of a small or medium-sized tourism enterprise can carefully and accurately assess that risk level. Let's look at this specific case, the check-in at a hotel. And this is based on this matrix. And we have an Excel, a simple Excel where we have translated the various possible combinations that you can see in the John's matrix, so that when we select where we are located, what area we are assessing, what the occupancy level is social distancing being respected? Is it indoors or outdoors? Are we wearing masks or not? And what the exposure time is, then with all those factors, we will obtain a result, green, orange, or red, depending on whether the risk for that particular situation is low, mid-range, or high. Let's take a look at this tool. Just for those of you who are following the presentation in English, you'll be able to view at the top of your screen. If you are listening to Spanish, just stay with me. But if you are following in English, look at the top right-hand area here where the arrow is, where it says View Options. And once you have located that View Options, find English Slides. And we do this so you can see that Excel file in greater detail, both in Spanish and in English. And once you've located this additional screen that will be opened up for presentations in English, we will continue to the transmission risk assessment tool. Okay. As we were saying earlier, on the IDB website, you'll be able to download this very easy to use tool for self-assessment of transmission risk in a specific environment. Here we see the risk assessment tool. Select that. I've given you the introduction already during this session. And we'll give you an example here. We'll select the subsector that we are evaluating. So this Excel sheet opens up. This has been adapted based on the John's matrix for various tourism sectors, hotels, restaurants, local transportation. We take all of them into account. Also, we will select the area we want to assess. Here we have some tourism accommodations, and we haven't specified all the details. We'd have too many slides to show you the entire tool, but it's not the same to assess risk in a hotel room where it's only the customers as compared to the reception area, but it's a tool that can be used by staff and by clients of the hotel. Once you've selected the subsector and the area, we can go on to the next slide to determine whether the occupancy level allows us to maintain a safe distance. Is it high? Is it low? In this case, we're going to select high, a high occupancy level. And we're also going to select the type of ventilation we have. Are we in an open air outdoor environment or in an indoor area that is well ventilated or poorly ventilated? Let's assume that there's high occupancy and it's indoors and it's poorly ventilated. It's a reception area that does not have sufficient ventilation. Now, regarding the mask, are we wearing masks? For this case, we're going to assume that we are not wearing masks or it's without adequate mask. And what is the exposure time? Is it more or less than 15 minutes? Let's assume that it's over 15 minutes because there are fewer employees and there are fewer people, so it takes a little bit longer to check in. So the tool will take us to the assessment conclusion. The finding will see on our screen what the situation is. In this case, it's high risk, and it'll also give us some guidelines in terms of how we can reduce that risk. For example, having people wear adequate masks, reducing exposure time, having better ventilation, and reducing occupancy levels. So we've looked at those factors, but what would happen if we switched two of those risk transmission influencing factors? For example, instead of with the occupancy level we're now going to have low occupancy, and we're going to switch to a well-ventilated indoor area. We're going to open the windows and leave the doors open so we get air from the outside coming in. We still do not have adequate masking, and we have above 15 minutes. But now our risk level is medium, so we have substantially reduced risk. And the tool gives us some more guidelines to further reduce transmission risk. For example, the use of adequate masks and reducing exposure time. And as expected, if we continue with low occupancy and well-ventilated indoor area, sometimes in reception areas, unless it's like a vacation resort with pleasant temperatures throughout the year, we can't always do things outdoors. And if instead of having inadequate masking, we now do have adequate masking and we reduce exposure time to less than 15 minutes, now we have low transmission risk. So what we want to say with all of this is that each situation, based on how we combine these factors, will result in higher or lower transmission risk, and of course, the risk of spreading the virus. So what we do with this assessment is to coordinate all these elements within a tool, all the elements from the chart, and all these different levels in this Swiss cheese or Gruyere cheese, we put them all together in the app. So we encourage you to download the app from the IDB website. We'll give you the URL link after the presentation as well for your convenience. But in addition to general recommendations and this risk assessment tool, which again can be used for any one of the sectors under the scope of the project and for different types of spaces and activities that took place in these hospitality environments, we've also developed videos, a series of 7 videos with general measures, management measures, and then 5 videos, 1 per subsector: restaurants, accommodations, beaches, local transportation, ports, and airports. And these are videos that give you a practical view of this analysis by presenting a situation around these factors that influence transmission risk and a maximum level risk situation where these factors, these risk factors have been combined in such a way that we have maximum risk. Then taking that as a starting point as maximum risk, we can see how the measure take can make a difference. So we're going to show this video, and it's for restaurants in this case, just for you to see an example of the videos we have for the various sectors in the tourism industry. So the risk factors and some of the measures we can take. This is the video.
Risk Node 1 Dining Room. This is a small restaurant, and it does not have windows that can be opened. Although it does have air conditioning, it is only turned on when customers are present. The restaurant is in a place where it is not possible to have outdoor seating. As a small restaurant, they try to make the most of the available space so the safety distance between tables is not always respected. When there are no customers on the premises, employees remove their mask. Customers also remove their mask as they settle at their tables. They usually spend around an hour and a half having lunch or dinner at the place. Recommendations to reduce transmission risk. Keep the doors open and turn the air conditioning on in full extraction or maximum extraction mode, allowing the greatest possible air renewal and avoiding its recirculation. Ensure 2 meters between tables. Ideally, accommodate diners by preventing the airstream from flowing directly from one table to another. Communicate and control the maximum capacity allowed according to each space. Provide your employees with N95 type face mask without a breathing valve, and enforce them to wear a face mask all the time, with or without customers in the restaurant. Ask clients to wear their face mask whenever they are not eating food or drinks, even when sitting at their table and when they move. Reduce as much as possible the time staff stay in contact with clients.
Los vídeos plantean, en primer lugar, como hemos dicho, para
The videos present, as we were saying before, just to recap, a risk situation, taking into account that these risk influencing factors are at a maximum level for maximum risk, and then provide some measures that you can use to reduce the risk based on those factors. And the methodology, the approach is the same as for the self-assessment and the checklist, where we really insist on those risk influencing factors and take them as a basis. So what happens with humidity? Maybe some of you have asked yourselves why we have not mentioned it in this video. It is mentioned in the general recommendations video. And let's remember that this is an aspect that can be controlled only in indoors environments. That's why we don't mention it in this video. Now, we have here the entire set of tools and resources that are available to you on the IDB's website. That number or series of general recommendations in blue. In green, we have recommendations for the management, implementation, and control of protocols. And we're also going to continue to look at this in other videos. And then in orange, we have specific recommendations for restaurants, beaches, local transportation, ports, airports, and for accommodations, tourist accommodations. And the tools that we have, such as the Excel sheet we saw earlier, and the other tools that we've provided are tools that we've based on what we saw were mistakes that people were making. We saw the type of mask that was used depending on the space that we are occupying. That's important. And all these materials are available in English, in Spanish, and they will also be available in Portuguese. There is the website. You have the information in Spanish as well as in English. You can see up here, first of all, the diagnosis report. Then after that, you'll see the transmission risk assessment tool, and the infographics will also be available for you there. And that's all from me for now. And we have a few minutes for questions and answers. Thank you very much, Marie Cruz, for that presentation. I want to thank our partners from the OAS and EMT who have provided so much support to us in this effort. I'm seeing some questions in the chat. If I may, Maricruz, I'll also share with you some other questions that I've received. Are there any costs to the use of these checklists, infographics, etc.? Well, the set of recommendations includes 7 documents, the assessment tool, and the infographics, and all these materials are freely available for anybody who is interested. They are downloadable from the IDB website, free of any charge. Great, and the links are in the chat. I don't know if you've been able to access them, but we can post them for you again. Another question, and I just responded that, can you share the links? Yes, you can share these links. In fact, we encourage you to do so. We actually have a campaign for these recommendations to be shared as widely as possible, because the more people share them, use them, and update their protocols, the more protected we will be, of course. Yes, I agree. And a third question, Maricruz. Tell us about the use of alcohol gel sanitizers. That's a very common measure taken in the region. Should we stop using that? Is it less relevant than other measures? Well, as we said in the presentation, this virus spread by 3 routes: by aerosol, that's the most important one, and then by direct contact with droplets from breathing, and then we can maybe touch our mucosal membranes. And then the third one is contact with contaminated surfaces, but this is less likely. It would have to be that somebody who has the virus would expel a droplet, and then somebody with their hand or with their foot would touch that droplet and then touch their mucosal membranes, having that live virus on their fingers. That's less likely, according to scientists who are experts on this virus. But this doesn't mean that we should just forget about that precaution. We should continue to use it. And during the time that we conducted the diagnosis, we visited various places in Latin America and the Caribbean as well, where we have seen that there are many people, in fact, who sanitize their hands when they enter an establishment, whether it's in the tourism sector or in other industries, but all the windows are closed and there's insufficient ventilation, or the doors are not open. So of course, you should sanitize your hands, but let's not forget what the most common transmission route is. And if you use alcohol gel to sanitize your hands, you can do it if you don't have water and soap. But if you have soap and water, then you should just wash your hands. Thank you very much, Marie Cruz. I received some questions internally through the chat, but we have one in the general chat as well. I'd like to get to it since we have time. Are there any graphic analyses that allow us to better identify the results of the actions we're taking? Well, the assessment tool does not include graphs. as such, but it does allow us to combine different factors and get different results. So we can see if you change this aspect or another aspect, if we improve ventilation, for example, by how much would we receive our risk? And if you can't modify your ventilation, you don't have perhaps the money to invest in ventilation. I also cannot open windows. But if I modify this other aspect or this other element, what results can I get? That is the usefulness of this tool. In any case, the tool is complemented through a series of videos. We saw a bit of one, but I do invite you to visit the IDB's website to watch not just this 2 minutes extract of the video we showed today, but the entire video. They're 7 to 10 minutes long each, and they help us evaluate risk conditions and understand those measures that we can take, those better practices that we can adopt so we can be safer in the face of COVID. Thank you very much, Maricruz. We apologize to our guests. We don't have time for any more questions, but I do invite you to visit the website. I'll send you the link once again. I'll post it in the chat so that you can take advantage of all its content. The content is free of charge. The idea is for it to be used in the public sector, private sector, all the stakeholders all over our region. So we have the highest number of people possible who have access to it. We have already published it in Spanish and English, and it will soon be published in Portuguese as well. Thank you very much, Maricruz, for your presentation. I want to thank the teams that have participated in this effort, the OAS, the OMT, and all of you who have participated. We hope it's been useful to you. And the recording of this meeting will also be available soon in this website hub that we've sent you the link to. Thank you very much, and let's continue to be safe. See you soon.